Okay, so the question says a client has not had a bowel movement for 4 days and has been prescribed milk of magnesium, 2 teaspoons orally, as needed for the relief of constipation. How many milliliters should the nurse administer? So first, you would look at your conversion sheet, and you would see that 1 teaspoon equals 5 ml, and the question is asking for 2 teaspoons. 2 teaspoons. So you just multiply 2 teaspoons, right, times 5 ml. You would get 10 ml total. Okay, to the next question. A client with diabetic ketoacidosis is to receive a continuous infusion of regular insulin. The physician the physician ordered 1 liter of 5% dextrose and water solution to run at 150 milliliters per hour. Once the client's blood glucose has reached 250 milligram per deciliter, the drip factor of the tubing is 15 drops per milliliter. How many drops per minute would the nurse deliver? So this is the important stuff here. This right here is fluff. This is fluff to trick you into question. So you're going to do the formula for infusion, which is amount per milliliter multiplied by amount of drops in milliliters over 60 minutes. So we're going to do 150 milliliters per hour times 15 drops per milliliter over 60 minutes. Okay. And do the math. 150 times 15 equals 2250 over 60 minutes. So divide by 60 minutes, and you're going to deliver 37.5 drops per minute. But you can't have half of a raindrop, so you have to make it 38 GTT per minute. On to the next. An 80-year-old client with internal bleeding admitted through the ER after a motor vehicle accident. The physician has ordered two units of packed red blood cells. One unit is 250 milliliters. 250 milliliters to infuse over 1 hour each. The drip rate on the blood administration is set to 10 drops per milliliter. The nurse administered how many drops per minute to infuse as ordered. To infuse the blood as ordered. So some more fluff here. This is fluff. This is fluff. Ignore that. And this is important. 1 hour each. So again, we're going to use the same formula, which is 250 milliliters, right? 250 milliliters per hour, right? Times 15, or 10 drops per milliliter over 1 hour again, so 60 minutes. So 250 times 10 equals 2,500, right? And then 60 minutes. Divide that by 60 and we get 41.6 drops per minute. But can't have half of a raindrop again, so we gotta make it 42 drops per minute. Okay. So next question is, a nurse is to infuse 100 milliliters. You gotta highlight the important stuff so you don't get lost. 100 milliliters of 5% dextrose in water solution containing an IV antibiotic over 30 minutes. The infusion rate is set. The infusion set delivered to 10 drops per minute. How many drops per minute would a nurse administer? So this would be important here, and this would be important. Some more fluff again. This is fluff to confuse you, and this is fluff. So use the formula again. 100 milliliter, right, times 10 drops per milliliter over 60 minutes. So 100 times 10 divided by 60 equals 6 drops per minute. But we can't have half of a raindrop again, so we gotta make it 17 drops per minute.